Hello, my name is Mohammed Al-Haj and I will be presenting the Capstone project of preventing pressure injuries. The purpose and some objectives behind this is to prevent or reduce the amount of pressure injuries in any healthcare setting, a hospital or skilled nursing facility or whatever have you. We will be providing data and research regarding the subject, and it's to bring more awareness of this. Some backgrounds and significance of the topic of preventing pressure injuries is that this affects 1 to 3 million Americans every single year. This is not mentioning the global problem that is regarding the pressure injuries. This is for the most part avoidable. Pressure injuries are not 100% avoidable, but for the most part they are avoidable. And it requires a low-level skill to prevent these problems, as you will see soon. The problem statement is: in bedridden patients at risk of pressure injuries, how does the implementation of more frequent education, and specifically a protocol of turning the patients every 2 hours, how does this affect the reduction in the incidence of pressure injuries? Now to the meat and potatoes of the subject, the literature review or the science or data or peer-reviewed data behind this is this task of turning is usually delegated to techs, someone of a lower skill or technical level, and due to this, people see it as not such a high priority. Oh, the techs can just do it, and then this will go into the mind of some nurses as not being so important, and this is not the case at all. There is a 25% reduction in pressure injuries when you compare a turntable of 2 to 3 hours to a 4 to 6 hours. So when a hospital changes the protocol of turning a patient every 4 hours to turning patients every 2 hours, you have reduced the amount of pressure injuries by 25%. And the best possible outcome regarding a patient with wound and whatnot is good skin care. Registering any predisposing factors of pressure injuries, for instance, a person is elderly, or their Braden scale is below 18, or they have some perfusion issues. Understanding that, you can know if someone's at a higher risk of having a pressure injuries, and repositioning every 2 hours. Having a pressure injury decreases the quality of life. It increases pain, morbidity, and even mortality. Yes, people die from pressure injuries. In a study across 90 countries and over 1,000 ICUs, found it shocking that 59% of the pressure injuries that were found were hospital-acquired pressure injuries, HAPIs. Almost 40% found on their sacrum, almost 20% found on the heels. So check those areas. Increased awareness of this issue, appropriate use of resources, and further research will tackle this important problem that is mostly overlooked. The cost of the treatment of a wound or pressure injury is nearly 2.5 times that of the prevention. The cost to fix the problem is 2.5 times the prevention. This is just the cost-wise. This isn't including the pain and suffering on the patient and the increased hospital stay that it brings. Education and training of hospital staff can greatly reduce the amount of HAPIs, and they improve a nurse's competency, visual discrimination ability, and their clinical judgment. Look at this chart. This is the study of over 1,000 hospitals, of over 1,000 ICU units. Look at almost 60%, the red and the orange, are hospital-acquired pressure injuries. Plan and implementation. More frequent education will be needed. Re-education, because this is not a complicated subject. This is not rocket science or brain surgery. It's not something that requires a lot of deep depth critical thinking. Just turn the patient, assess the patient, check if they have any problems. Every now and then, go and implement a turn routine every 2 hours can greatly reduce pressure injuries. You can have workshops to bring more awareness to this, online classes, PowerPoints that we have right now. You can address or go talk to a wound care team, ask them what are the best things to do. Skin prevalence training. In my particular hospital, they have skin prevalence training that is required, mandated. Every year, a nurse must choose a day where they go to every single room on their unit and they check and assess every single patient's wounds. They check how many layers are beneath the patient, how many white chucks, how many blue chucks, the sheet. They check to make sure it's not too much. And few barriers to this plan and implementation is the staff's acceptance. Will staff actually turn a patient every 2 hours, or will they just keep what they're used to of every 4 or 6 hours or whatever? And accurate charting. Perhaps the nurses will accept it and chart every 2 hours that the patient was supine here and then they're on the left side, right side. They'll chart it, but they won't actually do it. These are problems that we can face. Evaluation. 6 months time is more than enough time. You can evaluate to see if the number of pressure injuries has reduced in the hospital with the implementation of the 2-hour schedule and the re-education and more frequent education, more awareness of this topic. Has it reduced the numbers of happies in the hospital or not? They can look at the EHRs to see if the nurses are following protocol or not. Few barriers. Nurses missing the initial assessment when a patient comes in of a pressure injury, and few days later, another nurse actually assesses it. A patient comes in with a wound that they had prior to admission. Now it is counted as a hospital-acquired pressure injury. This will skew the data. Also, patients refusing turns. They're in too much pain, so they don't want to turn, and then they get a pressure injury. Nurses need to give proper education as to the importance of turns. Poor diets can affect it, post-surgical positions, and nurses not assessing. This can all skew the data or the evaluation of this. Dissemination. With proper research, it can be brought to the attention of charge nurses, supervisors, managers, your co-workers. You can bring it up in huddles, just talk about the importance of it. It can even be brought up to the board of nursing, how things can be changed, how to better implement things to lower the amount of pressure injuries. When consulting an expert, Ms. Rachel Smith, who's been a wound care nurse for over 10 years, I asked her, what is the most important thing regarding pressure injuries to prevent them? She said, offloading, offloading, offloading. Nothing is more important than getting off, turning them every 2 hours. She said, especially the sacrum and the heels. She said, nurses need to turn more often and chart properly. These are ways we can prevent pressure injuries. Summary, pressure injuries are causing unnecessary pain and suffering, longer stays at the hospital, financial strain on the hospital, more use of resources that can be allocated properly, more effective and more frequent education, and stressing on the importance of a proper turn schedule, 2 hours compared to the 4 hours, will definitely lower the numbers of happy in the hospital. These two very simple interventions don't require high skill or anything, can prevent a lot of pain and suffering. The references are in an attached Word document, and thank you for listening.